Okay, so elbow special tests. Before I get started, I just want to point out the anterior palpations that you might be able to find is the biceps tendon that comes right here into the cubital fossa. You can feel it pretty nicely, but if you have some trouble, just ask the person to flex their biceps and you'll be able to feel it. We also have the brachial artery and the median nerve that run through the cubital fossa there. So for our first test, we're going to want to do some valgus and varus testing to test the collateral ligaments. This is very similar to some of the varus and valgus testing we've done in other parts of the body, such as the knee. So for this, you want to make sure to find their 0 point of extension. A lot of people can go into hyperextension, especially women, up to 10 degrees or more. So be sure that you're looking for that. He actually does not have hyperextension. So this is his 0 point. I can feel his electron quite nicely into the fossa, and he is at 0. Whereas myself, obviously, I can go into some hyperextension, where this is going to be hyperextended, and this is actually going to be my 0 point, which for me feels bent, but it's not. So this would be 0 for me. So be sure to find that. You're going to have their arm like this, you're supporting it down here at the wrist. You're going to press one hand here against the lateral side of the elbow, and you're going to apply valgus force while moving the wrist towards you, and you're really trying to stress that ulnar collateral ligament, trying to open up that joint. You'll get a little bit of play on this side, but if you detect increased laxity or if they report pain, then you want to compare bilaterally. For a varus test, we're going to come on the medial side here of the elbow, testing the radiocollateral ligament. Again, stabilize down here at the wrist. Apply your pressure here at the medial side of the elbow. Make sure that they're in their 0 point of extension and nicely relaxed. And then you're going to just simply apply that varus force, pushing laterally while moving their wrist towards you. The next one we're going to test is lateral epicondylitis. This is testing the extensor group here on the lateral side. They all have a common origin site at the lateral epicondyle. So in order to test this, we really want to test their muscles' ability to sustain extension. So you're going to support here at the back of the elbow. You can test them at either 90 or 45 degrees, somewhere in between there. But 45 degrees, it's more of a stretch, so it might be a little bit more difficult for them, especially if they have lateral epicondylitis. You're going to ask them to make a fist. You're going to ask them to then extend their wrist, bringing it back.
Sure.
Extend their wrist, not their elbow. And then you're going to have them try to resist you as you push down. And if they report pain, or if they're very weak and they give up right away, they likely have some lateral epicondylitis issues. And then for medial epicondylitis, we're going to test the medial epicondyle, which is where the common flexors originate. For this test, you're going to do almost the exact opposite. You're in 90 to 45 degrees. You're going to have them make a fist again, and they're going to flex up. You can also wrap your fingers within their fingers as they flex up. But what you're going to want them to do is hold this flexion here as you try to pull their hand into extension, and they should be able to resist. If they give up very quickly or they report pain here at the medial epicondyle, they likely have some medial epicondylitis issues. The last test that we have is Tinel's sign. So for this one, you want their arm to be nice and relaxed. You want to support here at the elbow. You can secure their hand here at your side with your elbow. And then you're going to want to take a couple fingers, come behind here, find that medial or that cubital fossa on the medial side. And once your fingers are nice and in that groove, then you're going to just simply take these fingers and tap lightly on the back there. And for someone that doesn't have a problem that shouldn't really elicit any pain or numbness or tingling down the arm, it should be a completely normal thing to be able to do this. If you're lightly tapping with your fingers or a reflex hammer, they report pain or radiating sensation down their arm that affects especially their third or their fourth and fifth fingers. That's going to be an issue. They likely have some sort of ulnar nerve, like entrapment issues or ulnar nerve lesion problems. They'll also commonly report having difficulty with grip, so really being able to grab onto something with these two fingers being compromised. And those are the special tests for the elbow.